maybe while we get started, Dr. Ochoa, do you mind, kind of talking about what a diamond session is and maybe just kind of introducing everybody to what they're going to be doing today as we give everybody a little bit more time to jump in?
Well, I'm excited to see some of my colleagues, of course, and then of course I see some family and friends that I invited to the meeting. I see my current faculty supervisor, so just a blessing to see all the names. So hello to everyone. If you've never been a part of a diamond session, the reason for the change of rooms, thank you, Stephanie, for doing all that, is we're going to cover some important information on how to assist in one another with, traumatic events, casualties, things that happen in our lives that are overwhelming, but to do it from a non-counseling, a non-fixer perspective, meaning that any given person can really be there to assist or help individuals in time of crisis. And I think through the diamond sessions, which means if you really hang on, you'll be put into personal rooms where you'll be what I call a story catcher. You'll be a faculty member, of course. You'll be an observer and you'll be a reporter. And then once we break out into those diamond session rooms, some of you who are professionals without even knowing it will come back and we'll cover one of the scenarios that we listed out, and you'll be able to share from your, I guess you can say, dialogues and encounters with the individuals that you went to those breakout rooms with, seeing and the response of people and how we're able to be there for each other. We are focused on the 2026 Culture of Care Summit, which is the power of care. So it's going to be pretty awesome that y'all are going to see the reflections that y'all have off of each other's responses in order to see how we can always be there for each other. So I'm kind of excited. I know that this was new to the council, the faculty council. Michelle, thank you for being so excited, for taking this on and asking me to be a part of this Culture of Care Summit. So just know that I'm really excited about what we're about to embrace in.
Michelle, you're
You're
on
on,
mute.
yeah.
Sorry, I'm multitasking. I'm admitting that fault. I am letting Catherine know in the other room, they are not able to click on that link that was given to them by Catherine. So they need to repost in the waiting session there, waiting room there, to refresh their live site so that they can join this one. So let me get that done real quick, and I'll let Bill and Dr. Ochoa kind of hang out with you guys for a minute till we get everybody over here.
I haven't seen Bill in a while. This is nice.
Hey, Flori, how are you? Good.
How are you, Bill? Long time no see.
Yeah, good to see you. Good to see you. See a lot of good faces, and I follow you on LinkedIn, and I see you doing some great stuff. So keep it up. Keep on keeping on.
Same to everyone. I agree. Thank you, sir.
All right, so we've got that done. Everyone, I just want to welcome you to this session. Again, Dr. Ochoa kind of talked a little bit about it. We are running a little late, just trying to get people in from the other room. Appreciate your patience as we had a technical difficulty with breakout rooms in our webinar room this morning. And so, and just got word they are going to repost in that waiting room over there. Instead of a link you all cannot click, but to refresh your live sites, and that'll give you the new link here. So I expect we'll have a few more coming in. But cannot be more thrilled that Dr. Ochoa offered to do this session. He kind of talked a little bit about what a diamond session was. It was something totally new to me, and just thought it sounded like a really fabulous way to engage with people about this content. And so, Dr. Ochoa, I'm just going to hand it over to you. You let us know what you want to do. And I do think he wants everybody on video. You're welcome to. This isn't going to be a regular type of session. This is going to be an interactive, let's learn from each other session. So I encourage you to do that. Dr. Ochoa?
Awesome. That's it. Let's go to the next one. We're going to focus on assisting individuals with crisis and training. It kind of looks like we'll have right now currently 18 individuals. Oh, it popped up to 20. So that will determine the breakout session rooms, depending on how many people you put in each, and try to make them even, of course. But the overall objective here today is to empower you with the confidence and the skills to support others who may be experiencing trauma. I think everyone here knows at one point or another, we're going to experience some form of trauma. We're going to go through what some would consider in layman terms, difficult situations, problematic situations, habitual issues, things that are out of our control. It's sad to say that at one point or another, we're going to have to undergo what we would consider hard times, even though that's not something we want to face. But I'm here today to empower you with the confidence and the skills to be set up to support others who may be feeling overwhelmed when life challenges come our way. Let's go to the next slide. How we're going to do that today. I'm glad that some of you are asking. On to the next slide. So after today, I'm hoping that if you've never been a part of a diamond session, is there anybody who's ever been a part of a diamond session? If you have been, just kind of maybe do the little emoji where you wave your hand. But if you've been a part of a diamond session, these are going to be breakout rooms that you're going to be attending. You don't have to show your face. If you could unmute your mic when those sessions take place, I think that would be awesome. You're going to be able to better learn to understand and discuss the nature of trauma. Sometimes people, when they get involved in difficult situations, the hardest thing to do, especially being in a discipline, let's say like a faculty, let's say like a counselor, let's say like a pastor, let's say like a doctor. Sometimes when we carry these Superman capes, those are the hardest times to be able to share with people when you're going through something. So I'm going to help us through these techniques to practice basic communication techniques. We're going to be able to recognize common psychological and behavioral trauma reactions, and overall just be there for each other during these difficult moments, being able to speak out here in a little bit when you see, some of the scenarios that I've listed out. There's some things that go on in our personal lives that we would never think would ever happen or come to pass. So through these practical sessions and through these diamond exercises, you're going to see that today you're going to be able to learn how to be more compassionate. You're going to be able to recognize the distress levels of other people. You're going to be able to respond with care and connect with individuals to, appropriate support. If we can go to the next slide. These are some statistics. Many people are not about statistics, of course. If you're a doctoral student, you know that we do a lot of research, scholarly research to try to see how empowered we can be by statistics. And I want you to look at these statistics. You'll just see that it was reported in 2013 that approximately 90% of the U.S. population would be exposed to either one or more traumatic events during their lifetime. So these are things that are unavoidable. We're going to have to experience some form of trauma at one point or another in our lives. And look what this trauma does. In 1998, suicide rates had been raised to increase 62% in the first year after an earthquake. Think about that. 31% in the first 2 years after a hurricane, and then almost 14% 4 years after a flood. Those are just traumatic events that we see all over even our country just alone. And then you'll see in 2002, it was assessed that the prevalence of an acute post-traumatic stress disorder, which we know as PTSD, and depression among residents just of Manhattan 5 to 8 weeks after the terrorist attacks on September 11th, all those that were interviewed were reported that 7.5% symptoms consisted with a diagnosis of PTSD related to those attacks. And then we saw that depression occurring within the previous 30 days. Go to the next slide, please. Along these lines, you'll see that nonverbal behavior sends a powerful message. Often the first impression is based upon appearance. The challenge is how to make that impression useful in the service of crisis intervention. I have a certification through SISMS, which is critical intervention, systems management, stress management. And you'll see that some of these nonverbal communications like silence, which says beware, you'll see that excessive use of silence in crisis situations can communicate lack of interest, thus causing an escalation. Facial expressions and eye contact, body language. There are a few hard and fast rules here. What does this mean? Sometimes when somebody is really in need, and let's use the faculty, for example. If you're a faculty member, I'm one myself. Sometimes we get on these patterns where we're on this Thursday of participating in discussions, grading, we have deadlines. Then you come to the point where a crisis takes place. We don't realize that sometimes we're there to meet the need of the student when they have crisis happening. But what happens when we're attempting to get grades on time, or we're attempting to respond on time when a certain crisis happens in our personal life? Well, when it comes to meeting the need of somebody, one of the worst things you can do is just, some people say listening is the best, but sometimes listening and never saying anything could be pretty harsh, because then the person that we're serving the need of could think that we have no interest in hearing and then responding to the need. The way we look at people and respond to them when they do come with issues, and the eye contact that we made and the body language that we present, it's very powerful in how a person will receive the need of help when it comes to participating with them and trying to get them through the struggle that they're going through. Let's go to the next slide. So even closed questions restrict the response options available. So what do I mean by that? The yes and no questions are the most restrictive. So you'll see stems that include do you, don't you, is this, isn't this, did you, was it, were you? We have to be cautious, because be careful not to ask too many serial yes or no questions. Open questions in varying degrees tend not to restrict answers. So open questions include what, when, where, why, and how. And you're going to see that here in a minute when you're involved in the diamond rooms and the breakout rooms, when y'all come back with feedback. Next slide, please. We hear mirror techniques. When I was reading the book that was written by George Everly Jr., and that was Assisting Individuals in Crisis, talks about these mirror techniques, and sometimes thought of as active listening. Mirror techniques are designed to reflect back. So if you're listening, you'll know that you're really truly listening if the right question is asked. There's another term called embodied listening. For example, I'm going to use Bill as an example. Bill comes to me and he says, hey, Dr. Ochoa, I have this issue going on with me and my daughter. My daughter was going through this issue and it's made me feel really down. How do you help me overcome this? The wrong question at that very given moment to Bill would be, well, tell me a little bit about your daughter. Why? Why would that be inaccurate at that moment? Because I take the focus off how Bill's feeling and I put the focus on Bill talking about his daughter, even though that would be a good question down the line if Bill opened that door. But the emphasis in this mirror technique would be to focus on Bill's feelings, Bill's emotions, and Bill's concerns, rather than taking the circumstance elsewhere. And I hope that makes sense. In most common situations, when people tend to focus on how to do a mirror technique and reflection, when it comes to emphasizing with the individual, they may ask about the person's dog. If the person is stressed about losing their dog that they had for 20 years, they're more focused on the dog than they are how Bill feels of losing his dog. And like I said, I hope that makes sense. Mirror reflection is mainly staying focused on the individual and doing whatever we can to assist the individual and how the individual is feeling, and not taking the focus off them. Next slide. So what I'm going to do right here is I want to tell you how this is going to work. It shows that we have 18 individuals. So that's maybe let's just say 5 rooms of 3, if that's possible. Is that possible, Stephanie?
Yes.
Okay. And we're not going to choose how that happened, but this is going to be the roles, and you get to choose your roles. So if you're an individual in there, we're going to go with a story catcher, a faculty member, and a reporter. So right now, since the number of colleagues are not in here, we'll stick with just the top 3: story catcher, faculty member, and reporter. You're going to break off in these rooms. You're going to get to choose if you're the story catcher, which means you're going to be the one listening to Clarissa, who is in our scenario. The faculty member will be Clarissa themselves. So one of you will actually be Clarissa, the faculty member, and then one of you is going to listen to the dialogue as a reporter. Once we break off into these rooms, we'll do it for like 10-minute break-off session. I'm going to give you the scenario, then you're going to come back and I'm going to ask you questions based off the story catcher the faculty member, and the reporter. Anybody have any questions before I read the scenario? You're welcome to unmute your mic so we can give clarity, so this can be more empowered than what you think by not knowing what you're going to be doing. Any questions?
What is the difference between the story catcher's actions and the reporter's actions?
So the reporter is just going to be listening to the dialogue. They're going to be listening and stating what they may have felt the story catcher did not do right or do not, or needed to probably maybe emphasize more on. So the reporter is just sitting back, listening to the dialogue and maybe helping the story catcher when we come back to say, well, my story catcher maybe should have listened more than talk more, or maybe the story catcher asked the wrong question at the wrong time during the dialogue. Does that make sense, Ms. Justine?
Yes, thank you, Dr. Ochoa.
Yes. So the reporter is also playing a huge part. Just because you may not be the story catcher or the faculty member, don't think that you're not playing a huge part. You're going to see how important it is what we receive from the reporter when the reporter also comes back and we ask questions on the this diamond session. Any other questions in the room? It kind of looks like, Stephanie, some may have not wanted to participate in the diamond session, which is okay. So it says now we're down to 14. Okay, here's the scenario. Faculty member Clarissa just recently had her husband pass away and was left with 3 children. She is currently teaching a human service course that consists of 19 students. She has some grieving issues with the loss of her husband and has fallen a little behind on discussion responses and the deadline, the Monday grading has passed. Her oldest daughter, Carrie, is a senior in high school and never wants to be home with mom because mom is constantly crying. Middle daughter, Courtney, was just diagnosed with lung cancer, which requires twice a week treatment. And youngest daughter, Claudia, cannot stay out of trouble at school and is currently in ISS. Clarissa has already had her husband's truck repossessed because she could not pay it and has had bills just continuing to stack up. And Clarissa has also had thoughts that she thought she'd never have, but she knows that quitting is not an option. So turning to alcohol was a better choice in her opinion. She is stressed, she's depressed, she has suicidal thoughts, and just wants to quit. So now at this time, one of you, when you get out into the breakout room, and say, I'll be the story catcher. The other one will be the faculty member and the reporter. And the story catcher, knowing the scenario already, is going to open up the dialogue and say, Clarissa, tell me a little bit about what you're going through. And then that's when the dialogue will start. Stephanie, after 10 minutes, we can come back.
Okay, I'll open the rooms now.
Dr. Ochoa, while we're waiting, what is your background in these trauma consults? Is this something that you've done with the military, or I may have missed that at the beginning?
Good question. I'm actually a head discipline chief for all the state hospitals in Texas, the mental state hospitals. So what I do is I hire spiritual care, which are chaplains, military, all sorts of chaplains for every state hospital in the state of Texas. Which was requires to deal with individuals who are incompetent to stand trial. So dealing with the worst of worst criminals in the state of Texas before they're found competent to stand trial.
Very interesting. Thank you, sir.
Yes, sir. So it looks like we have everyone back in the room. This is how this is going to play out. It's really interesting. Promise you, this is very beneficial. Not because I'm teaching it or instructing it today, because it really helped me. One of the things I want to point out, I was the reporter for Dr. Charles Holmes, and the other individual in there was Monica. How do you pronounce your name? Kobus?
Kobos, that's correct.
Kobos, okay. Monica played the role of the faculty member. Dr. Charles, of course, was the story catcher. What I observed in there, and of course, while I was writing notes down, I observed Dr. Charles offering many resources. And when he was offering these resources, Monica said, well, with the current position that I'm in, I'm struggling with the financial part of it. So, you know, even though you're offering these, I might not financially be able to pay for them. And Dr. Charles acknowledged the fact that this would take a big hit on her. So what he did is he decided to say, hey, look, since I'm a faculty member as well, how about I step in and assist you on this? I'll take over the class and I'll do whatever I got to do to fulfill that role until you get things together, until this class is complete. So that was pretty neat. This is me seeing the dialogue that was occurring. So what I want to do now, since I was in that dialogue, is ask Dr. Charles how he felt when he was dealing with this faculty member. Of course, he asked her whether she wanted to be called Monica or the name in the scenario. But Dr. Charles, tell us what you felt when you were speaking to her based on the issues that she was going through.
It was challenging. The one of my difficulties is separating empathy. So the trying to take in the information that was provided, and all the tremendous loss and all the things that are happening to the individual in the scenario, but stay in the space of how can I help this person get through the day? How can I help them get through the next week? What do they need to move forward? As opposed to I'm not great at just sitting in the moment of I'm so sorry. Let's just talk about all the hardships you're going through. And some people do need that. I'm not great at that. So I always try and say somewhat solution oriented. So that sort of may have been a bit of a disconnect for me. It's something I'm working on, but yeah, that's sort of the challenge I faced, was keeping the reality of what was going on at a distance so that I could focus on helping that person.
Good. Focus on more of the element, which was the job, the faculty position. Even though you wanted to be empathetic, you didn't want to race to that because you didn't want to get caught up in the system of, overlooking where you could really assist. Monica, how did it feel when Dr. Charles was assisting you?
I honestly think it was like still empathetic, like the tone of voice was, like calm, friendly, and I think that would keep like an individual kind of like in a settled but supported way. And I think just the resources that were being offered as well, it could kind of put, for example, in the scenario like Clarissa, in a state of like, okay, I do have support. I don't have to go through this by myself, and someone is there who knows my situation. It's just not me carrying it now, and I can maybe get through this day or this week.
Awesome. So it's clear that we see that she felt assisted by Dr. Charles. So he really accomplished what he needed to accomplish as a story catcher. Who was in room one? Who was the reporter in room one?
Dr. Ochoa, we got like halfway. We were just getting started.
Okay. Yeah.
Halfway through, but Claudia was I was like the student or the faculty member, and she was asking the questions, and then and Shannon was going to be the reporter and the observer. So we did get
Let
halfway
that short
through.
dialogue go because we got one more scenario. So I think everybody will have a run up on what's supposed to be done. But in the short time, what did y'all get through? What did you focus on?
Shannon, I don't want to. Yeah, if you want to go ahead.
That's okay. Claudio was asking Bill about how he felt about the hardships that he was facing. So she was taking more of a empathetic approach, and trying to help him get a handle of his feelings. And, maybe in turn, once he got a handle of his feelings, he would be able to move forward. Perhaps if we had got deeper into the scenario, perhaps she would have been able to offer resources, but I really liked her asking about the feelings because, me personally, I like to talk about my feelings, and a lot of people aren't like that, but really having someone to listen to me about my feelings is really helpful.
Awesome. Claudia, what kind of approach did you take? Is what they're saying accurate?
Yes, I was trying to understand where she was coming from. I don't even know what to say, her, she, or him, but just
Hmm.
trying to understand so where I could pinpoint of where I needed to start with getting the help that they needed.
Awesome. Bill, how did that make you feel? Did you feel like with the position that you were in, she was asking the right questions?
Yeah, and we didn't have a chance to get too deep into it, but I could feel the empathy and the compassion, for me to try to work toward some kind of solution, and then we just kind of ran out of time. But no, I like the whole model. Absolutely.
Awesome. Here in a minute, as we talk to the last group, you are going to have a little bit more time, and the second scenario will be just a little bit different. But I'm kind of grasping that you are kind of getting an idea of what we're doing, correct? Okay, awesome. What about the third room? Who was in, was it room 3? Who was the reporter in room 3? I might have been in 3. Was it room 2?
We were in room 4.
Okay, room 4.
Yeah, so something that I really appreciated is that Justine had mentioned, really validating the person's feelings, and what they're going through and acknowledging that they are going through a lot. Because, similar to what was said earlier, is just having that validation of what you're going through does feel as big as it is, and it does feel overwhelming, and it can lead, to unfortunately like chemical dependency. And so having that kind of first conversation of just validating that person, and then afterwards being able to just be human with them and try and connect them with resources as much as possible, because that person needs to be there not only for themselves, but they have kids they need to take care of. They have kids that are going through their own things, and dealing with the death of their father, dealing with cancer, which I was just like, this person seems to have really just been thrown everything at once. And so just telling the person it's okay to be human, it's okay to feel these things, but at the same time, like, you have to be there for yourself and for your support system. And so what can we do to get you back to somewhere where you can feel a little bit healthier, to be able to do those
Awesome.
things. Yeah.
Thank you, Mr. Green, for sharing that. Well,
Yeah.
it's not a coincidence, but isn't it odd that sometimes when it rains, it pours? It's not like one thing occurs at one moment. Sometimes we do feel like this domino effect of issues overwhelm us, and it happens more than often than what we think. Who was in the room with you?
I had
was
Justine,
Dr.
yeah, and Letitia and
Okay.
Jimmy.
I was
Let me
in
hear
there.
from you. All right. Let me hear from y'all.
Much to what Jason said, I agreed with sharing of the resources, and also like Dr. Holmes, solution oriented in any approach is the best approach. Ruminating in negative affect and negative behaviors is only going to compound those traumas. But taking it back to the original reason for these behaviors are the feelings that are the helplessness and the wanting to quit. And so recognizing and validating those feelings for legitimate reasons, but also reminding them that although understandable, completely unacceptable given people depending on her. So recognizing where it's coming from is going to help her identify the trajectory for where she needs to be going. And then with the help from the resources being provided to take that path and create that path. But again, we're in a bit of a crash course pace. So I don't know that we got to experience all 4 of the roles fully.
We're going to get to experience those roles in the next scenario. Justine, what role did you play in your group?
I was the reporter.
The reporter. Who was the story catcher?
I was.
Jimmy, what was your approach?
Well, like they said, we barely got really into it. I think if we'd had a little bit more time, we'd have been more in depth. But I could just see the compassion and heartfelt sincerity that they had towards towards this person, of all the things that life was dealing at, throwing at them at this moment. I could feel they could be sincere, really caring. Because when you talk to some people might not really feel that what you're going through, just trying to go through the moment, but I can actually feel that they're sincere about this person and cared, wanted to get all these resources to them to be able to help them. If we'd have been able to get a little bit more in depth, I think we'd have be able to get more things said about the situation to help this person out.
Awesome. So this is what we're going to do. We're going to go to scenario 2, but before we go to scenario 2, does anyone have any questions about what we've dealt with so far? So maybe if you're unclear of the route we're going with these diamond sessions, I want to clear it up before we go to scenario 2.
Can you give us a brief example, role-playing example of what that looks like to provide the crisis intervention without dependency on trauma dumping, so to speak, or ruminating
Yeah.
in negativity?
One of the things that people do when they go and they initiate a conversation with people who are dealing with trauma is, for some reason, they think that it'll assist them better if they shoot out their title. Basically, hey, I'm a counselor. Can I talk to you? Why do y'all think in essence that would be a good thing and possibly a bad thing from anybody?
May scare them away. I don't know. You know,
Mm-hmm.
And
That's true, Bill.
also,
Could steer them away. Go ahead, Justine.
it might feel like a life raft and they would cling to it too strongly to navigate their own thought.
Okay, good.
I'm thinking hierarchy. They're trying to put themselves in a position of authority, like I can fix this. I've got this background.
You're right on, Dr. Charles. It's basically sometimes when people are dealing with crisis, they don't really care about your profession, your title, who you are. So I kind of like the approaches that y'all said y'all come in with. I was hoping that no one would have said, hey, I'm a counselor, even mentioning that you're a faculty yourself. The approach that would have been very, I guess you could say, good for this approach would be just going in and trying to understand the individual's feelings and what they're going through at the moment. What I like about dealing with people who are going through traumatic events is you don't have to inject feelings. Does anybody know what I mean when I say inject feelings?
Is that making an assumption of what they're feeling?
Correct. And in most cases, people fail there without realizing it, because they'll go into a conversation when people are experiencing traumatic events and they'll say, well, you look really sad, or it looks like this has caused you to be really mad. Those are things that we don't do, is we don't inject feelings when we're dealing with people with traumatic events. What we do is we look for open doors and we allow them to share their feelings, but those feelings come with, listening, asking the right questions, simple questions as, well, tell me what you're feeling, because they'll clearly state what they're feeling instead of injecting. Have you ever dealt with someone when you say, well, you look really mad, and that individual wasn't mad, but because you stated that they were mad, they begin to project in their mind, well, maybe I am mad. And then they start to be mad. And in essence, they were never mad. So just dealing with the individual and talking to them and stating, hey, tell me a little bit about your situation. And then upon hearing that situation, there's a term that I know that's called embodied listening. I learned it through what we call pastoral clinical education, which you take that person's body movement, and in that moment, as a story catcher, you can actually see what they're going through. I want to use Dr. Charles as an example, if that's okay. Dr. Charles.
Yes.
Can you hear me?
Yes, I can.
Dr. Charles, will you tell everyone how you brush your teeth?
How I brush my teeth?
Yes, sir.
Okay. I wake up in the morning, I have it off to the right side of my sink, apply the toothpaste, get a little bit wet. I usually do the outside first, and then under, and then inside.
That's a good way to brush your teeth. But did y'all notice that I asked him, can you tell us how to brush your teeth? And what did you automatically see Dr. Charles start doing? He started to reveal his story. He started showing us how he brushed his teeth without even realizing it. We know now from listening to his story where his toothbrush is at. If you were listening, where's his toothbrush at? It's off to the right. And then he began to tell us that he applied the toothpaste. Did anybody see what he did with his hand when he said, I put toothpaste on my toothbrush? He kind of did this, swipe. And then he said, next, I bring it up and I start to go, and then he started showing these expressions about getting on each side. That's embodied listening. That's just an example. I know this is about brushing teeth, but in a real scenario, these are the things I look for. So if Clarissa was to say, I feel overwhelmed, that's how I know what question to ask. Tell me about what you're feeling when you're overwhelmed. Because she's not only telling us with her mouth, she's revealing to us with her actions. If this is where she's feeling overwhelmed, that's how I know what question to ask based off her embodied listening, based off me seeing her actions, because she's really living at that moment. Now, Dr. Charles, without thinking I'm being funny, did you see yourself really in your restroom brushing your teeth when I asked you, did you please tell us how you brush your teeth?
Yeah, I visualize myself when I wake up and how the process goes.
That's
Yeah.
it. That's it. So this is what happens when people are really telling their stories. So Justine, I hope I answered your question when you say, could you give us a little bit of an example? This is how we would take every approach. What we're going to do now is we're going to go to scenario 2. You're probably going to be in a different group. So look at scenario 2. Faculty member Bill just found out that his wife is in a serious car wreck in a major city, and he's worried. He rushes to get dressed, and out of his way out the door, he trips and falls and breaks his ankle. He is in pain and yells for help, but eventually calls 911. While rushed to the ER with his ankle, he still has not found out the status of his wife. While in the emergency room, he hears and sees staff running to a code blue, and he asks the RN that is caring for him if everything is all right. The nurse replies, a girl who just had a major car accident just coded. While hearing this, Bill's phone rings, and the phone says, my love. Out of suspicion, he answers it and says, hello? A county sheriff says, can I ask who this is and who's this phone I'm calling from belongs to? Bill says, it is my wife's phone. The officer then says, well, your wife was in a car wreck, and we believe that she was drinking and driving, and she ran a red light and hit 2 high school girls. One girl died on the scene, and the other one is fighting for her life at the ER right now. This is scenario 2. When you go into the room, you're going to play a different role. If you were the story catcher the first time, be the faculty member. If you were the faculty member last time, maybe be the reporter. Just switch roles. And then we're going to come back and we're going to see these observations. I'm going to give you a little bit more time to go into these diamond session rooms, and then let's see the reflections when we get back. We're going to send you We are coming up an end. We just hit the second scenario. I kind of hope it went a little bit faster than the first one did. For some of you may have head up. But before we end, I want to go straight to room number 4. If you were in room number 4, tell us about your dialogue and how it went this time with the scenario of Bill.
I honestly don't recall our room number. I don't know what room we were in.
I think you were. It was Claudia, Dr. Charles, and Mr. Green in room 4.
Oh, very good. Claudia, you were our reporter. Do you want to?
I think it was interesting. The way that I believe it started, it was like maybe giving information of what the story was. If I'm able to express myself correctly, but yeah, I think I don't know what else to
What is
say.
your were you focused on the story catcher right now or the person that was
No,
actually
just the
experiencing the
reporter.
trauma?
I was just the reporter. It's just what I
And
was observing.
and what did you observe with, let's start with the story catcher.
Um, the story catcher just asked, well, I don't know how to express the fact that he just said, well, it seems like you're in a hard situation,
Right.
more towards that.
But
And
let me
then,
go to the, let me go to the faculty member. I guess that was Dr. Charles.
Yeah, I was the Bill in this scenario this time. Yeah.
What's important about these diamond sessions is to be completely honest about what you felt from your story catcher. How did you feel, Dr. Charles?
I felt supported. Kaizen had a compassionate tone, acknowledged the complexities of things, and then offered, how can I help you with the situation, and then tried to set up a kind of a meeting for coffee and just to figure out, how can we, you know, navigate this situation. So it was again kind of what we did in that first one, where you're getting that sense you're not alone in it. There is someone that's aware of what's going on, and they're going to try and help you navigate it, which is very helpful.
Great. Mr. Green, how did you feel when you were dealing with Dr. Charles in this scenario?
Yeah, I definitely felt for Bill, aka Dr. Charles, and the situation that they're in, and like Dr. Charles talked about, just having the layers to the situation, and so something that I really wanted to kind of emphasize is just taking things one step at a time, especially for me when I get overwhelmed and I don't know what to do next. It's just like, let's see if we can just like collaborate, brainstorm, break things down into steps, and just take it one thing at a time. And so like the one thing that I did mention was just like, you're hurt, you have a broken ankle, you're in the hospital yourself. Let's focus on getting you checked out. We'll take those updates about your wife as they come. But we can maybe sit down and see what resources are available, perhaps through the university, to maybe get legal assistance, or just some sort of additional support to help this faculty member kind of get through this trying time for them. And so yeah, I just emphasize baby steps, and just being there, and just being that kind of shoulder of support. And I really wanted to emphasize, like, tell me how you feel. You seem distraught, but I want to know, what it is that you're feeling. And so, for Dr. Holmes, he was just like, there, I don't know, I'm still processing. There's a lot. And so just offering to be like, I'll be there to help, process if that's what you need, just offering to be that kind of person for them.
Awesome. Bill, were you Bill this time?
I was not Bill this time, but I was the reporter, or the story catcher. And
What did you were the reporter or the story catcher?
well, we had only three of us in the room, so I kind of just, I guess, took both roles. But
Okay.
the thing I'd like to say is I really am enjoying these constructs, because as I'm watching the dynamics, I saw I saw a tone, compassion, um, and Letitia was questioning very well. And the deeper we got into this, I could see tone changing and feeling and concern, and trying to find some resolutions. When they were talking about being at the hospital, they said they should have a social worker or someone there that might be able to support you, another level of support. Justine, she did very well. And, for what we had in the scenario, in the role play, she was able to hit the problem areas, the state she was in. And the one thing where my mind was going is how real trauma is. And I'm not to get off topic here, but when we had the green zone training not too long ago for military personnel, one thing that taught me, and I'm learning here, was how real that really is, inside. And So I applaud this, and but that's kind of what I had the opportunity to see, and I thought they both did very well in the role play. But as I saw it, I saw, a solution based. How can I help? What can I do? And I think in a real world scenario, there'd be even more effort given to let me follow back up with you and let me see how you're doing later and all that kind of thing. But I thought it went well.
So Justine, Letitia.
Yes, so I took the approach of kind of triaging the trauma. So first concern was the wife, where she was, what condition she was in, getting the call from the police, kind of stirred up a new trauma and a new concern, new crisis for him, but then had the offer of the social worker to come to find her and find out the situation of the wife. Kind of opened the door for temporarily satisfying that need to then address personal emotional issues to help start regulating that by identifying what that state was.
So, Letitia.
Okay. Can you guys hear me? I had a problem getting off of mute. Yeah, the concern was to make sure that, she was playing the role of the husband, that the husband was okay, to get the husband to be just a bit more, I wouldn't say comfortable, but to at least know the state of his wife. I thought that was the most important thing at that moment, to know the state of his wife, because he, didn't know. He was, concerned about, what happened with her and things like that she, was drinking and all of this, but never knew the state of his wife. I thought that was the most important thing. And then from there, everything else would follow. So my concern was getting someone to assist with, at least knowing where the wife was, how the wife was, because, the sheriff had said one had died on scene, the other one wasn't doing well, but we didn't know who was who.
That's good because Bill's ankle probably didn't hurt as much as he was thinking about his wife at that moment, if that makes sense.
Right.
So that's pretty interesting that you brought that out. Dr. Charles, thank you so much for doing what you do. Thank you for being a part of this. We are about to conclude. I hope that you understood the purpose of the diamond session. I hope you all understood that, you don't always have to be a fixer or a counselor in order to help somebody. So before we end, and of course we're on time frame, does anybody have any questions, any feedback, maybe any concerns, anything that I can answer before I hand it back over to Bill?
I would just like to say that I think this was extremely beneficial. These are great constructs. You built an awareness, you've increased an awareness on these types of things that do happen, because they do occur, in the journey, whether it's in the classroom or in life. And so, I applaud that. I kept thinking about these little index cards and these steps you have, and I said maybe we'll get lucky and he'll send out an index card that we can put in our wallet or something. But I think this was a very timely reminder in this world today of the things that do pop up, and I think I applaud it. So thank you.
Thank you, Bill. Anyone else?
Similar to that sentiment, I very much appreciate this, kind of session. I work primarily with military students, and there's a lot of complexities to their situations. And, I think having empathy and care and understanding at the forefront is what really helps guide my advising in those situations. And so, everything learned here, I think, just kind of just reinforces that support for our students, that we might not be counselors, but we are people that understand that the human condition is complex, trauma is complex, and it's a process. And so I just very much appreciate the session, Dr. Ochoa. Thank you.
Thank you, Mr. Green.
Dr. Ochoa, I just have one question, just kind of after Kaizen spoke. I had given a talk a year or two ago on leading with purpose, empathy, and compassion. And the question I got, and I'm going to ask you this question, it was a good question. Somebody said, can you go right to compassion without having empathy? Meaning like maybe some people just start feeling all these different things for someone when maybe they didn't put themselves in their shoes. You know, that's kind of how I interpret it. How might you look at that?
I would always tend to say that every scenario is different. It depends on the situation. It would depend on the individual, but it's really dependent on the situation. For
Okay.
example, if this was really you, Bill, I would probably tend to be more compassionate because maybe the connection, maybe, you know, knowing you through the university, people go from this empathy to complete compassion because, you know, I have this relationship with Bill. Oh my gosh, Bill, look what Bill's going through. Almost like that of a family member, if that makes sense. So
Sure.
it's like I tend to kind of gravitate more towards that because I'm like, well, hold on. We just have this email exchange for a whole month and we've been attending faculty meetings together this whole month. So it goes to that point, I guess, depending on the person and the situation.
Sure.
It shouldn't be, but sometimes we usually do because of the individual that we're dealing with.
Yeah, very good. Thank you.
Yes. Thanks a lot for your feedback, Ms. Justine, in responses to this. I think that you're right that the active involvement and putting people into the diamond sessions kind of brings things to reality. And that was the whole purpose of this. Hey, this was the first time I've done this as far as a diamond session over Zoom like this, as a leader, as leading it versus being a participant in it. So I really hope that you did grasp something from today's session. Moving forward, I hope that you get more from all the other sessions that you'll be attending in the next couple of days of the 2026 Culture of Care Summit, The Power of Care. Bill?
Dr. Ochoa, we want to thank you for a wonderful session, very enlightening, insightful. And we just appreciate all you do in presenting a great presentation and also bringing it to life with these role plays and so forth. So thank you very much.
Thank y'all. I hope y'all have a blessed day.
Thank you.
You too. Thanks.
Thank you again, Stephanie.
Yep, thanks.
Thank you.